Everyone has joined now. So we start the orientation session. Good evening, everyone. I am Shivam Sinha. Welcome you all to the orientation session of the Sarvoday TheRise Foundation, which is a youth-led foundation. So this orientation is for the Sarvarogya project. Now further, Sneha ma'am will lead you to the further discussion about the organization. So over to you, Sneha.
Thank you, Shiva. Good evening, everyone. I'm delighted to welcome you all to the first batch of Sarvarogya, which you all know is a research based public health initiative of Sarvoday TheRise Foundation. Also, I would like to extend my sincere gratitude to Prasad Institute of Medical Sciences, Lucknow, for supporting this initiative. Sarvoday TheRise Foundation is a public policy think tank that is based in Lucknow. Before I walk you through the website and our work, it is first important to understand why do we exist. See, there was a time when the debates and discussions in the university campuses shaped the foundation of the public policies. These were the spaces where ideas were nurtured. They challenged the conventional thinking and they inspired change. Today, many of these spaces are shrinking. Public discourse has been reduced to just noise, and the research papers and the opinion tools are beginning to be shaped by artificial intelligence rather than original human thought. And if we start thinking like this is really dangerous. We are living in a time where critical thinking, analytical thinking is itself becoming a radical act. And this is where we are, as a think tank, position ourselves. A space for young professionals to think critically beyond the conventional barriers and to come up with unconventional but practical solutions. We are the space for nurturing innovative ideas, a space for serious thought. See, we need to understand that we are a generation that is inheriting very complex crises, be it in terms of the climate stress, technological disruption, or mental health issues. We cannot solve the 21st century problems with 20th century thinking. Also, the policy making is not the sole responsibility of the only politicians or bureaucrats. It is a shared responsibility. Why not the people for whom the policies are made form a part of the policy making process itself? Be it in terms of reading the policy gaps or coming out with new frameworks, as we are going to do in this Sarvarogya. And in this spirit, Sarvarogya was launched. Mind you, this is not a clinical research, it is a public policy research which requires a clinical perspective. Now the question arises, why is Sarvarogya needed when many such institutions already exist who conduct public health research? See, this is an experiment. An experiment where we are consciously placing the young medical professionals at the heart of the policy research. These are the people who do not know healthcare only through data sheets, they live the problem. And because they live it, they can diagnose it better. Now, coming to the structure of the internship. See, during the internships, you all have been assigned one report or policy brief which you will have to submit by the end of the fourth, sixth, or eighth week, depending upon the duration of your internship. Every week, you will be required to send us some content. We will review, correct, and we'll get back to you with the feedback. For guidance purposes, there shall also be mentorship interaction with the Sarvarogya team, which Shivam will tell you at the end of the session. Also, in some weeks, we'll host some webinars where experts will be invited to deliver talks, and you'll get an opportunity to ask questions to them. So, overall, this internship is not about just completing a report, but it will be about engaging in a meaningful learning process, which will, of course, deepen your understanding of public health. So I warmly welcome each one of you in this journey rooted in the Gandhian principle of Sarvodaya. Sarvodaya means upliftment of all, as we believe these better ideas create better systems, and better systems create better lives. So now I will walk you through the website. which I'm sure you all might have already gone through. I'll just share my screen with you all. Yes. So is my screen visible? Can any one of you just say?
Yes, ma'am, it's visible.
Okay, great. So, as you know, this is our website. There are a lot of articles that are placed. We have a special section of briefs and reports, and this is the place where you'll all have to contribute. There is a special section of opinions, where we have sections on world affairs, science and tech, environment, education, society, economy. We also have a section for the explainers where we explain Supreme Court and High Court articles in a easy way. These are our initiatives. Sarvarogya, as you all are a part of it. Our other flagship program, that is the Rise Internship Program. I'll walk you through it. Um, our special state-based, state-focused internship program, that is Hamra Bihar and Amader Bengal, and our section of Book Sutra. We also conduct on-ground surveys, and also have a YouTube platform. So this is our journey so far. We have 90 plus authors, we have more than 40 plus interns, and 800 plus publications, and the number continues to increase. Now I'll walk you through the journey so far. We started in 2020. When we started, we were just an opinion platform. In 2021, we published our first yearbook. We launched Vichar. Vichar is a special initiative where youth contribute their articles. We were a very small organization. We started with little some authors. There were around 50 authors, but slowly and slowly we extended, we grew, and we launched more and more verticals. By 2025, we launched several initiatives. We launched our YouTube, we launched our Instagram, and here we are with the Sarvarogya initiative. Uh, these are our program, the internship programs. Also, these are the people who contribute to the in-house research of the think tank, the Rise internship program, the Hamra Bihar, as I told you. These are the state-focused research-based initiatives, the Amader Bengal, um, and the Sarvarogya. There is also a design and communications internship. Now the our flagship program, that is the Rise internship program. It is a year round program where we conduct research on special SDG related topics. These are our institutional footprint across India. We have students from Central University Kashmir to Puducherry University and University of Madras, and on the west from the Gujarat National University to the University of Kalyani Presidency and the Jadavpur University. Also, we have their photographs on the website. There will be a separate page for Sarvarogya, and let's see how many people can make up to that page. Um, these are our past interns who have interned with us. Their institutions and the topic on which they have interned is clearly mentioned. This was our special initiative, that was a research based initiative on Bihar, where we conducted on ground reports, where we conducted analysis, research articles on this. These are the interns who conducted it. And this is a special report by the report on pharmaceuticalization of obesity, which garnered lot of attention and appreciation both. It's also written by Dr. Alhad Mulkarbar. Now I'm showing you this because this is your output that you'll see after 4 weeks, 6 weeks, and 8 weeks internship. Shivam will tell you more about this, how to write the research and the research methodologies. This is how we work. This is how we the output will come. Um, and this is one of the finest reports that has been published so far. Looking forward to more such reports from people like you. Um, of course, we are there to guide you, and this is how we write it. So now I'll ask Shivam to please walk them through the research methodologies and how shall they write. Yes, Shivam, over to you.
Sure. Just give me a minute. Ma'am, is my screen visible? Hello. Okay. Hello, everyone. Today we are going to talk about something that sounds very serious, which is research methodologies. But I try my best that by the end of this session, it will actually make a lot of sense for you because as you are doing research on the various topic related to health or other fields, so think of it a way that every time you scroll through Instagram and see a reel that says 5 studies show that this diet works, someone did this research or to find something. Every government scheme, every medicine, every new school policy, someone had to do a study problem first before solving it. Today we are going to learn exactly about that. We are going to cover about various type of research methods and how researchers collect data and what are the ethics. So we moving toward that. Firstly, we are going to look to the qualitative research. What is qualitative research? Qualitative research is a way of understanding the world by collecting stories, opinions, feelings, and experiences, not the numbers. It answers the question why and how, rather than how many. The word qualitative literally comes from the quality, meaning the nature or character of the something. So instead of counting things, we try to understand them deeply. We can understand them by a simple explanation that imagine you want to understand why students in a village are dropping out of school. You don't just count the numbers of dropout. You sit with the families, talk to the kids, speak with the teachers. You listen to their actual stories. That is qualitative research. You are collecting experiences, not the stats. So when we do the qualitative research, we mostly do it that qualitative research when numbers alone can't tell the full story. Some things that are too complex or too personal to just put in a
Uh,
spreadsheet.
Shivam, I think Sir is here. Sir has joined us. Um, so welcome, Sir. Um,
Just give me a minute.
So everyone, we have Dr. Bhupendra Kumar Sanjay as our chief guest for our orientation session. He needs no introduction, but still, Professor Bhupendra Kumar Singh Sanjay is the world-renowned orthopedic surgeon from Dehradun, Uttarakhand. He was born on 31st August 1956 in Bundelkhand. Sir went on to receive Padma Shri in 2021. Sir completed his MBBS from GSVM Medical College Kanpur, followed by MS in Orthopedics from PGI Chandigarh. He further trained as a senior resident at Safdarjung Hospital. To advance his expertise, he pursued higher orthopedic training and fellowships abroad. On the basis of merit, he has been awarded several prestigious international fellowships, including the Swedish Government Fellowship, Swiss AO International Trauma Fellowship, and several others. Sir has presented over 150 research papers at the national and international conferences. His exceptional surgical achievements has earned him recognition in the Guinness World Book Record, Limca Book of Records, and the International Book of Records. He is the founder president of the Uttaranchal State Chapter of the Indian Orthopedic Association, a member of the National Academy of Medical Sciences, and a fellow of International Medical Sciences Academy. Currently, apart from being the president of All India Institute of Medical Sciences Guwahati, he also serves as a member of the Executive Council of HNB Uttarakhand Medical Education University and as a nominated member of the Academic Council of Gurukul Kangri University. Beyond a surgeon, Sir is also an author, poet, and a dedicated social worker. It is truly an honor and privilege for us to host you as a chief guest for the orientation session of Sarvarogya. Over to you, sir.
Namaskar, Sneha ji. Thank you very much, and you have given and namaskar to all the participants, and it's a very elaborative introduction which Sneha has given to me, and thank you very much for that. As you said, the topic is why India needs doctor as a public health leaders. I have a very simple philosophy for that, or it is not for me, it is for everybody. It is for everybody. If I say the health, education, and nutrition are the fundamental needs of each and everybody, I am sure all of you will agree. And these are the three which plays a very important role in everybody's life. I give my example. I don't know about others so many people, but I definitely know about myself. Say when I was born, my parents gave the food. That's why I could survive. And when I became a 5-year-old, he sent me to the school. And that to school, the government school, Hindi medium, where I used to take my bori to sit down over there. It's not me, everybody used to carry. So it is nothing shameful for me to share with others. In those days, we were not having the air conditioning or something like that. And if I became a sick, then my parents got the treatment from a doctor. If the doctor was not available, then got the treatment with the bed. Because of all these things, I survived, I became educated, I am healthy, I am here. Do you think there is any other than the three things which has played very important role in anybody's life or so? Yes. So the topic is very relevant, as you said over here. Why India needs doctor as public health leaders? Because as I mentioned, the health is the one which matters the most. You gain any amount of the knowledge, you gain any amount of the money, you gain anything, whatever you think is the best you can achieve and you can enjoy. But how can you enjoy if you are not healthy? This is, I'm not telling, this is true. When somebody is having the pain, and even if you give him the best, whatever it's a desirable things to him, but he will not accept that thing, what will be his desire? First, that his pain should get, he should get rid of the pain. So how much importance the health, this is the, and how much importance is the health workers. It is not only the doctors, but those who are the paramedics or anybody who is related, or all stakeholders who are working for the health or the health sector. So this is the importance, and I'll start with this thing. We as a doctor, you understand, we as a doctors, not only the healers. Actually, what I consider for myself, this is not only the role of the doctors as the healer, but the doctor can be a social worker, he can be a counselor, He can be a helper to anybody. Say, if any doctor is having any other skill, he can work like that. So it is not only the doctors which need, but the doctors are the leader to treat the patient. That's why the importance goes to this thing. Now imagine what happens, how that becomes the doctor. As per the old students, you know, for anybody, these are the three important things which are important for your life. For any profession, you need the behavior, knowledge, and the skill. And out of these three things, behaviors matters the most, because anything, whatever you do it, at least it starts with the behavior. As a doctor or as any profession or as a client, if you interact with any, you have to interact with anybody. And if your interaction is not acceptable to the other party, I think nothing will move further. I will, simple words, I will say, if for a boy, girlfriend or the boyfriend, if he propose in a very nice way, I love you, probably you can be honored and you can be accepted. If your way of proposal is not very good, then you know what will happen. In the Hindi, what I say, otherwise, यदि आपका प्रपोजल बहुत अच्छा है, तो हो सकता है आपको फूलों की माला मिले, और यदि आपका प्रपोजल अच्छा नहीं है, तो निश्चित ही आपको जूतों की माला मिलेगी. So this is the importance of the behavior, that you all of first you try to, whatever you are doing, knowledge comes the later on, first comes the behavior. So this is the value of the behavior, and I have given this example in certain ways so you can understand easily. As a doctor, you are sitting in the OPD or I am sitting in the OPD. When patient comes to me, if I do not interact with the politely, nicely, then I think nothing will move further. And for the any meeting on anybody, I say, oh, book dena, oh, namaskar wali padne ka. I say, you greet to each and everybody. Whenever you are coming in contact of anyone at any time, you must greet him, because greeting is the one thing which will give, in fact it will be the starting point for the interaction with the individual. And this is related with the every profession. And as the Sneha says, I am a poet and I have written a poetry book which has been published by the Gyanpith, later on the Bani Prakashan. And one of the poem is in that book is the Namaskar. You understand what is the value? It is a namaskar is just not like you consider it is a one of the greet word for the greetings. नमस्कार. मेरे एक परम मित्र ने मुझसे पूछा, हर किसी से नमस्कार क्यों करते हो? मेरे परम मित्र ने मुझसे पूछा, हर किसी से नमस्कार क्यों करते हो? उत्तर देने से पहले मैंने भी उनसे पूछा, फिर भाई ये बताओ, अनजान लोगों को कैसे अपना, अनजान लोगों को कैसे अपना बनाए, अनजान लोगों से संवाद कैसे करें, अनजान लोगों को अपना कैसे बनाए? क्या कोई है आसान सरल सस्ता रास्ता? इस बात का गलत ना लगाओ, इस बात पे झगड़ा भी मत करो कि नमस्कार से क्या मिलेगा, कितना मिलेगा, पर यह जरूर है कि कुछ भी नहीं घटेगा, पर बदले में मिलेगा पद, प्रतिष्ठा, प्रशंसा, पैसा, प्यार, प्रोत्साहन, पुरस्कार, नमस्कार. So this is the value of the namaskar, that one should greet to each and every, because you know once you start the greeting, I am telling you, this is my personal experience. When I travel anywhere, whether in the bus or train or plane, I try to talk to the co-passenger. And first of what I'll ask, I will not ask who are you, where are you going, what you are doing. No, I'll just say the namaskar. And I share one of the true example which has been happened 2-3 months back with me. I was sitting in the 1B seat, the person that's sitting in the 1C. So I sit down on my seat and I say namaskar. What was his reply? You know, do you know me? I say no. I'll come to know. Did anybody give reference my name to you, or somebody give the reference of my name to you? I say no. Then I say, why you say that? Then why did you greet to me? I say I greet to each and everybody. And now, if I am not known to you or you are not known to me, we will be known to each other. The other person on the first day he came, I also said the same thing and I greeted. You won't believe my flight was delayed for 1 hour from Guwahati to Lucknow, and we were upset and talking this and that to the. And after then, when we started talking with each other, we spent almost the Guwahati Lucknow flight is 2 hours. We spent 2 hours without any grudges to the airline. अदरवाइज जब ऐसा कुछ होता है तो कभी एयरलाइन वालों को गाली देते, कभी सिस्टम को गाली देते, इसी में अपना स्ट्रेस करते रहते. सो इट इज वन ऑफ द एग्जांपल, यू नो हाउ how much he is important to me, and we are so good friend of mine. One day I'm again sharing this example to you. I was traveling to the Nagaland in one of the university. I was going to give in a program in the Kohima. So I saw there is the National Research Center Mithun. I never knew about the Mithun, but I came to know Mithun is the one of the animals which is in the Arunachal Pradesh, part of the Assam, Nagaland, and the Manipur. It's a very unique animal. So I say I must visit this lab. I didn't know anybody. I talked to that person who asked me that, do you know me? I talked to that. He is the scientist and he is the in charge of the one of the CSIR lab. I talked to him. I want to visit that place. So डॉक्टर साहब मैं तो वहां हूं नहीं, मैं तो इस समय लखनऊ में आया हुआ, प्रयागराज में आए थे वो. हमने कहा आपको कुछ भी, आप प्रयागराज में आए, आप उनके बात करिए. हाँ मैं जानता तो हूँ, तो मैं ट्राई करूंगा. हमने कहा आप ट्राई करिए. तो उन्होंने फोन किया, कहते वो तो जो डायरेक्टर है वो तो दिल्ली में. हमने कहा क्या फर्क पड़ना, आप किसी को बोले कि आई वांट टू विजिट दैट प्लेस. यू वोंट बिलीव इट, इज कॉल्ड टू दैट डायरेक्टर एंड डायरेक्टर टॉक टू मी एंड ही फिक्स माय अपॉइंटमेंट. Fix my appointment. And this is what I want to convey to all of you. Whatever I do, wherever I go, हम एक पंथ दो काज में विश्वास नहीं करते. एक पंथ कई काज. क्योंकि यदि आप कहीं जा रहे हैं, आप एज ए स्टूडेंट, आई टेल यू, whenever we visit to one of the city, you visit one of the institution which is very important or famous for which may be in your field also, and try to meet at least the one person over there. He may be very important to you. This it will be helpful to you very much. So this is the one thing, is the behavior matters the most, and this is what is the important for you. Other comes the knowledge, because knowledge is the one thing which matters the most. Whatever is, देखो ठग भी बहुत behavior बहुत अच्छा होता है, वो ठगी भी कर लेता है, कुछ लोगों को बेवकूफ भी बना लेता है, लेकिन वो कितने दिन चलता है. इसलिए आपको अपने प्रोफेशन में must be very must have the good knowledge about the subject, because when you have the knowledge, it gives the self confidence. And you know what is the secret of success for anybody? आपने देखा होगा जिन लोगों को सबसे पहले आपको किसी काम करने के लिए आपका आत्मबल होना चाहिए. और आत्मबल कहां से होता है? जैसे मैं आपको बताऊं, कुछ लोग जैसे स्टूडेंट्स हैं, कभी आपके छोटी स्कूल जैसे प्राइमरी, मिडिल या सेकेंडरी, जैसे टीचर आपसे पूछता है, सर कोई क्वेश्चन पूछता है. कुछ लोग तो होते ऐसे ही, उनको ये लगता है कि हमारी तरफ सर ध्यान ही ना दे, तो मुंह इधर को कर लेते, कुछ इधर को कर लेते. कुछ ऐसे स्टूडेंट होते जो अपने ऐसे करते, सर मैं बताऊं, सर मैं बताऊं, सर मैं बताऊं. कुछ लोग ऐसे होते हैं, और कुछ लोग ऐसे होते हैं बिल्कुल वो इधर उधर के, भाई पूछ लेंगे तो बता देंगे, वैसे नहीं है. तो आप ये सोचिए कि जो लोग ऐसे हाथ करते, सर मैं बताऊं, सर मैं बताऊं, उनका कॉन्फिडेंस लेवल बहुत हाई होता है. क्यों होता है? बिकॉज दे नो इट. इट्स वेरी सिंपल, 2 + 2 = 4. इसमें कहां हेजिटेशन है? If you know your subject well, you can tell to each and everybody, and they will, with your way of talking or your facial expression, body language, they will understand that person is a confident. And if you are confident and they perceive that, and he is the man who can do it, and he will do it, and that is what is the value of the knowledge. So you must gain the knowledge as much as possible, as accurate as possible. If you have any doubt about in your any subject or any question, better to inquire, better to read in the book, or you have the opportunity, better to discuss with your colleague or the senior colleague, especially who is an expert that field, and he will clear your doubt. So this is the value of the knowledge. Third comes the skill. As you know, when you got the knowledge, you have to apply it. जैसे हम डॉक्टर है, हमें पता है कि भाई ये इंजेक्शन लगाएंगे तो इससे बुखार कम हो जाएगा, ये इंजेक्शन लगाएंगे तो इससे हमारे मरीज का इन्फेक्शन कंट्रोल हो जाएगा, यदि मैं ये ऑपरेशन करूंगा तो उससे ये हो जाएगा. दिस इज द स्किल. अब स्किल को कब आएगी? जब आप उसको प्रैक्टिस करेंगे. whatever you and you whatever amount of the knowledge you have got it, if it cannot transform to the in the work, or it cannot be useful in your work, then there is no value of the knowledge. So this comes the skill. You must develop the skill. How can you develop the skill? वैसे भी होता, कहते भी करत करत अभ्यास के जड़ मत होत सुजा. बिल्कुल इसमें कहीं कोई गलत नहीं. यदि मैं अपने बारे में कहूं तो मैं ऑर्थोपेडिक सर्जरी को कम से कम 45 साल से पहले से कर रहा हूं, और ये कॉन्फिडेंस आज ही नहीं आया. जब मैं रेजिडेंट आज से 40 साल पहले आया था, तब भी हमें इतना कॉन्फिडेंस था. हाँ, दिनों दिन बढ़ता चला है. वो कैसे बढ़ता चला? जो कुछ भी याद करता हूं, आज भी जो कुछ याद करता हूं उसको पक्का करता हूं. मुझे इसका कोई वो नहीं है कि मुझे 100 चीजें आ जाएं, हम 100 चीजों को रख लें. लेकिन हाँ, ये बिल्कुल पक्का है, यदि एक चीज को हमें करना है तो उस चीज को हम जरूर जानते हैं और उसको हम पढ़ते हैं. तो दिस इज द वैल्यू ऑफ द स्किल. इसी बीच में ये आपको जरूर कहूंगा, आप कोई भी काम करें, बीइंग ए डॉक्टर, being an intern, or in any profession, you got the new challenges every day. Every day new challenges. Probably you might not heard about the solution, so better to go to the textbook. Especially nowadays, there is so much available in your hand in the medium of the smartphone or so. Immediately, even if I'll say simple thing, if I know what is the spelling of the knowledge, at least you can see in your phone, and you can be very sure this is the knowledge. And somebody asks some question, probably you can peep in the phone and you can say like this is the right question. So it will make you the practice like this way or no. This is very important. So if I say what anybody ask about me, what is the secret of success? I say for the me, it is the behavior, knowledge, and skill. And this in the same order as I mentioned earlier. Behavior comes the first, then the knowledge, and then the skill. And if you forget this thing, you just remember my initials, B.K.S. Sanjay. B for behavior, K for knowledge, S for skill. I'm sure you will never ever forget. And not only you practice this thing, you also give this message to the others as well. Now, I'll go only for this, as you said, you are the all health workers or the intern, the medical intern or so. You say the healthcare industry is always had been in the turmoil all the time. Say when I was the 50 years, 45 years back, I know there was the disease used to come tetanus. कभी आप लोगों ने जरूर सुना होगा कि भाई tetanus क्या होती है. Tetanus is the lethal disease, lethal infection. If somebody got it, if it is not treated, person will die. Same is comes the gas gangrene. Initially, this was the disease very common. It happens with the anaerobic infection, and the muscles get necrose, and ultimately, if somebody develop the gas gangrene, he is bound to die. Bound to die. Even in the best center, I myself have seen the patient dying because of that gas gangrene, only with the little bit infection. If somebody has treated, somebody has just cleaned these wounds in the case of the tetanus as well as the open fractures, probably patient will be, there's no question that he can have these kind of the infection also. This is what is happens. Maybe some complication, but it will. And even the doctors are not doing this thing. This is very shameful. I have seen few days, last month or so, patient has come from the AIIMS, is the very close to the Bagpat or Samli. He went to the government hospital, and when I inquired government hospital, they give the cannula, push the fluid, when he talked to me, I told him you must carry 4 or 5 liters of the normal saline because the patient was bleeding not outside but inside the body, and I knew that patient may die if he doesn't get the fluid, because to get the blood is not possible immediately. One thing, every fracture must be immobilized immediately. Any fractures, whether it is the forearm fracture, leg fracture, thigh fracture, especially the leg or thigh fracture, because these are the strong bone and very painful. If simple thing is that when many splinters are available, many splints are available, and if you are having a little bit knowledge of the orthopedic, you must be knowing the Thomas splint or so. And if you are not having the splint, at least you tie the both legs, injured leg with the normal leg, probably patient can be transported because it gives the pain, it increases the bleeding, and these all say that, and these patients can succumb there. Because if you are, and when the patients are traveling, now the situation is much better. The patient can travel now. In that, this patient came, use the Delhi Dehradun expressway, which is the very fastest expressway from the Delhi to Dehradun. You can reach in 2.5 hours, so, and that patient reach within 2 hours in the to the hospital also. So at least this is the role of all these things, because it is not the doctors alone which can save the patient. It is the all environment, infrastructure around which is being improving. It is improving day by day. Country is progressing day by day, and this is because, as you say, what I consider the value of the road is as they are the arteries. The value of the arteries in the human body, same way the values of the roads for the society. If your arteries are blocked, person is dead. If the roads are blocked, society is dead. So this is the value of that. And why I'm quoting, this is happening even nowadays. And what is the problem in the government hospital? Either they don't have the knowledge, or this is the apathetic attitude. And you are going to be a doctor, you must consider the doctor is the one which must have the compassion. If the doctor is not having the compassion, there is no fun to become a doctor. You must always remember, whatever you can do the best. It is not necessary that you are working in the top class corporate hospital or the best institution or the National Institute of the Importance. No, wherever you are working, you work with the utmost honesty, sincerity, compassion, because that will help to the society. Whatever you are having the resources, the facility, you work in those things, and then it will give. Because you are not the one. मैं तो इसको यहाँ तक कहता हूँ, हर व्यक्ति का जो विकास है वो वातावरण से होता है. हर व्यक्ति का, हर जीव का विकास वातावरण से होता है. आप सोचिए. और यदि आप इस तरह से आप, और हम आपसे सीख रहे हैं, यदि आप मुझसे सीख रहे हैं तो हम भी किसी न किसी से सीख रहे हैं, और आप जैसे लोगों से सीख रहे हैं. तो इसको हमेशा याद रखिए, यू आर द रोल मॉडल फॉर द सोसाइटी. यू आर द इंडिविजुअल. It is not that you are working for the nation building. Nation building is not the duty of an individual. It is the duty and responsibility of each and every citizen, and you are one of them. So you must remember that this is the value of the nation building. Because when our nation will grow, definitely we will grow. Now I'll talk to few things about the non-communicable disease. You know, as a doctor, you must understand what are the lifestyle diseases. Very recently, I'm sorry, very recently, there has been a report in the time which is published in the Times of India. This is the National Sample Survey report. You know, it's very surprising whether you are aware or not. The 50% of diseases are the lifestyle diseases in this country, and this is increasing day by day. Which I used to say 25 to 30%, this is the 50%. And this is not just like this, the all over the country this survey has been done, and one must consider it is the authentic survey. And this is our own experience. 25% people are having that diabetes. 15% are people are having the hypertension. 10% are having the thyroid. And the 15% are having the cardiac disease है. You are the young people, which I can see it. You know, the people are dying with a heart attack at the age of 30. It is very shameful for the nation. If something is wrong, what is wrong? What I consider, so these are the lifestyle diseases. One must avoid all these things, and obesity is the mother of all diseases. I'll tell you one thing which is very important. If we want to remain healthy, there are very few things. We are having the houses of the crore, worth of crores of rupees. Can't we afford a weighing machine which costs 1,000 rupees or so? If I ask each and everybody this with this platform, how many people are having the weighing machine at home? You know what is the value of the weighing machine? I'll tell you. When you go to the airport, and I am quoting my own example, I was in the guest house. I asked the person to bring the weighing machine in my room so I can weigh my weight. The weight was 2 kg extra, and airline charges for that. And I paid 1,500 rupees. If I carry the 500, 1,000 rupees, my own machine, probably I could have saved the 1,500 rupees, and that too on the one visit. I tell you, if your weight is ideally should be a 60 kilogram, and if you weigh your weight, and if it is 65 kilogram, and you know your ideal weight is 60, and it is 65, आपके कान खड़े हो जाएंगे कि नहीं? यदि हम किसी को, हम देखो सिंपल सा कहते हैं स्नेहा जी, एक ही एग्जांपल देते हैं, और विद द ड्यू रिस्पेक्ट, यदि आप किसी महिला की लिपस्टिक ओंठ से बाहर, लिप से बाहर निकल गई, तो वो अच्छी लगती है, खराब लगती है? खराब लगती है. यदि उसने गलती से लगा ली, चलते चलते लगा ली, शीशा नहीं देखा, तो कोई ना कोई तो बताएगा उसे कि नहीं? या हमारे की यार महिला बुरा मान जाए, अरे भाई बुरा कहाँ हम बुरा कह रहे हैं, हम तो यही कह रहे हैं बहन जी, भाभी जी, ये आपकी लिपस्टिक में या एक खाने का कुछ लगा हुआ है, थोड़ा सा आप देख लीजिए, शी विल क्लीन इट और उसको अच्छा बना लेगी. यदि हमारे कुछ हो गया है, हमारे मुंह में हो गया है और हमें दिख नहीं रहा शीशे से, हम सेब बना रहे, कट गए, तो इसको कौन देखा? इसको बैटरी लगाओ भाई, बैटरी लगाओ जल्दी से. आप इसको कौन करेगा ना? तो किसी न किसी तो शीशा हमारे लिए होता है. तो इसलिए एक मिरर बहुत जरूरी है, फुल साइज, फुल लेंथ मिरर एट एवरी हाउस. और आप बिना कपड़ों के आपको देखेंगे, कुछ इसमें कोई प्रॉब्लम नजर आएगी, आपके कान खड़े हो जाएंगे. स्पेशली आई एम टेलिंग यू, द ब्रेस्ट कैंसर इज द वन थिंग. If there is lump and there is the difference in the size of the breast for that particular, उसको ये पता चल जाए कि भाई ये हो सकता है, she'll go to a doctor, get the diagnosis, get the treatment, and you know the breast cancer is almost curable. You may be knowing, and I know many people are surviving for the more than 20 years. I know very well, and I'm not just telling like that on Kadena. So this is the value of the full size. Third comes the measurement, जिसे हम कमर नापते हैं. यदि हमारी कमर जो 34 होनी चाहिए, और यदि हमारी 36 हो गई, तो हमारे कान खड़े होने चाहिए कि नहीं? And this is the value of the, so what is need is the not only the, I will say, the awareness about the health, but it is the importance is the screening. There should be the public, and who can do the screening? I myself can do my screening. You can do your screening. For the cancer, there are many things. Say the anything, but it's simple से उसमें कोई जख्म इलाज करने पे भी ठीक नहीं हो रहा है, कोई भी लंप कुछ भी करने के बाद बढ़ता ही जा रहा है, कोई भी दर्द असाधारण दवाइयों के दर्द से ठीक नहीं हो रहा है, किसी भी जगह से अननेसेसरी डिस्चार्ज होता है, यदि कहीं से खून निकलता है या अननेचुरल चीजें होती हैं, ये सब कैंसर के लक्षण होते हैं. तो हम समझते हैं इन सब लोगों को समझना चाहिए. और आप एज ए डॉक्टर, इट इज योर रिस्पॉन्सिबिलिटी नॉट ओनली इन योर प्रोफेशन ऑल्सो, बट टू स्प्रेड द अवेयरनेस टू द पीपल. क्योंकि जो मैंने आपको बताया, यदि मुझे कोई कहे कि आपका गाल में कट गया है, तो मैं उसमें कोई दवाई भी लगाऊंगा, यदि मुझे पता ही नहीं चले तो मैं क्या लगाऊंगा, आप समझिए. सो दिस इज द वैल्यू ऑफ, तो हम समझते हैं कि हम सब लोगों की ये रिस्पॉन्सिबिलिटी है। मैं इसके लिए आप डॉक्टर के नाते भी, और जो लोग इसको सुन रहे हैं, मैं बताता हूं, बड़ा सिंपल सा है। आइडियल वेट के लिए योर हाइट इन सेंटीमीटर -100 रिमेनिंग इन किलोग्राम इज द आइडियल वेट। जैसे मैं बताऊं, यदि हाइट आपकी 6 फीट है, इसकी मानिए 180 सेंटीमीटर है आपकी, तो उसमें से 100 घटा दीजिए, 80 बचा, तो आइडियल वेट आपका है वो 80 किलो होना चाहिए। यदि आप इसको ध्यान से देखेंगे, इसी तरह से मेजरिंग वेट के लिए यदि हमारा हिप और वेस्ट का रेशियो, एक जो रेशियो होता है 1.2 का, यदि वो है तो मेंटेन है, यदि इससे ज्यादा डिस्प्रोपोर्शनेट है तो आपके लिए कोई प्रॉब्लम है। तो इसी तरह से बीएमआई के लिए कहते, बीएमआई में भी बहुत कुछ नहीं है। अगर हाइट इन स्क्वायर इन मीटर इज डिवाइडेड बाय द वेट इन किलोग्राम्स, बस इतना सा है। तो आइडियल जो बीएमआई होता है 24.9 होता है, जिसको आप 25 से नीचे मान लीजिए। यदि आप 25 से नीचे और 18 से ऊपर होते तो इसको एक आइडियल बीएमआई कहते हैं, और 25 के ऊपर बढ़ गए तो आपको उसमें ओबेसिटी, इसके लिए फैट ओवर वेट में आ जाते हैं, और 30 से ओवर होता है तो ओबेसिटी होता है। ये सब चीजें हम लोगों को आनी चाहिए और हम लोगों को सिखानी चाहिए। अब मैं आपको बताऊं इन सब चीजों को, लाइफ स्टाइल डिसीज का कारण क्या है। लाइफ स्टाइल डिसीज का कारण, सबसे पहला कारण है कि ये फैशन बन गया है कि यदि वो बर्गर खा रहे हैं तो मैंने, हाँ, नई चीजें होती, क्यूरियोसिटी होती, इसमें कहीं कोई दो राय नहीं। जब कोक आया हुआ था तो हम लोग भी अपने पैसे बचा के कोक पीने जाते थे, मैं अपनी बात बता रहा हूँ। और थोड़ा सा उसमें नमक डाल लिया तो और उसमें वाले होते थे तो उसका मजा लेते थे। लेकिन जब हमें समझ में आ गए तब तो हमने बंद कर दिया कि नहीं कर दिया। तो मैं समझता हूं कि जिन लोगों को अभी पता नहीं तो वो लोग इस बात को समझें। हमने डाइट इसी के लिए, इसको यदि हम बहुत ज्यादा ना बढ़ाएं तो हमने एक कॉन्सेप्ट दिया है ड्यूज, डाइट, एक्सरसाइज, वर्क एंड स्लीप। ये 4 चीजों के लिए देखिए, आपकी बैलेंस डाइट हो और रेगुलर एक्सरसाइज हो, डिजायरेबल वर्क हो और एडिक्वेट स्लीप हो, आपको नहीं से एवरीबडी कैन हैव द हेल्दी, हैप्पी एंड लॉन्गर लाइफ। डाइट में क्या लेना, बैलेंस डाइट का मतलब आप समझते हैं कि हम लोग इस समय खा नहीं रहे, अधिक कुछ लोग तो खा नहीं रहे, कुछ लोग ठूस रहे हैं, क्योंकि भूख तो नहीं लग लेंगे, जबरदस्ती खा रहे हैं। ऐसे कोई सेरेमनी जैसी चीज नहीं है, यार सुबह हो गया तो नाश्ता करना है, यार दोपहर हो गई तो लंच करना है, और रात हो गई तो डिनर करना है। और खास तौर से मैं उन लोगों के लिए, खास तौर से उन महिलाओं के लिए जो अपने हस्बैंड का बहुत ध्यान रखती हैं, उन माओ के लिए जो उन बच्चों का बहुत ध्यान रखती हैं कि बेटा खाए जाओ, ठूसे जाओ, बना दिया मम्मी ने। अब मम्मी भी परेशान है, पापा तो खाते नहीं तो बेटे के ऊपर ठूसती रहती, बेटा मैंने ये बनाया, बेटा मैंने वो बनाया। लेकिन उन माओ से कभी पूछो, आप बनाओ तो, लेकिन पौष्टिक भी तो बनाओ। हर दिन पूरी ही एक पौष्टिक होता है कि वही पराठा ही एक पौष्टिक होता है, या कुछ और चीजें भी हो सकती हैं। तो जिन माँ को नहीं आता तो मैं उनसे रिक्वेस्ट करता हूं कि अब तक आपने खाना बनाना नहीं सीखा तो खाना बनाना भी सीख लीजिए, और बच्चों को डिफरेंट चीज की है उनको इतना खिलाइए, लेकिन ज्यादा ना खिलाइए, थोड़ा थोड़ा खिलाइए और सब कुछ खिलाइए। लेकिन हाँ, उसके साथ आपको जो खाने के लिए जो मैं बताता हूं, मैं तो अपनी उम्र के लिए ग्रीन टी मॉर्निंग में बहुत अच्छी होती, नींबू पानी आपको लेना चाहिए। बनाना बहुत अच्छा फ्रूट है बेटा, खास तौर से हम उन लोगों के जिन लोगों को आपको नाश्ता नहीं मिलता या हॉस्टल में रहते हैं, जल्दी नहीं मिलता, तो बनाना बहुत अच्छा फ्रूट है, सबसे अच्छा है, सबसे सस्ता है, होल ईयर एक्सेसिबिलिटी है, और अफोर्डेबिलिटी आता ही 5 रुपए का है, बहुत ज्यादा 5-7 रुपए का आता है। आप स्कूल भी ले जा सकते हैं, टिफिन में भी ले जा सकते हैं, बैग में भी ले जा सकते हैं। जब आप बताइएगा मैं वहीं पे फुल स्टॉप कर दूंगा, वैसे मैं 5 मिनट और आपको बोलूंगा। इसके बाद आपको काम के ऊपर मैं बता दूं, बेटा देखो जो आपकी इच्छा वो आपको काम मिल जाए बहुत अच्छा है, लेकिन नहीं मिलता है तो जो मिल गया उसी को पसंद करने लगो। उसके लिए मैं एक ऐसे ही एनालॉजी, जैसे मेरे माँ बाप की तो लव मैरिज नहीं हुई, लेकिन हमने कभी ऐसा नहीं देखा कि मेरे पिताजी अपनी माँ के लिए जान ना देते और माँ पिताजी के लिए जान ना देती हो। तो मैं तो यही कहता हूं कि आप अपने काम से भी प्यार करने लगे, जो आपको इच्छाजनक काम मिल जाए बहुत अच्छा है, नहीं मिला तो जो मिल गया उससे साथ यार उसको अच्छा समझने लगो, ऐसी क्या बात है, उसमें अच्छा ही निकालो, ऐसी क्या बात। और एडिक्वेट स्लीप, आपको ये लगता हो कि सोने से हम बर्बाद कर रहे हैं समय को, तो ऐसा नहीं है। स्लीप इज द रिजुविनेटिंग टू ईच एंड। कोई आदमी 2 दिन से ज्यादा जग नहीं सकता है, और कोई जगता रहता है 2 दिन से ज्यादा तो वो पागलपन के लक्षण होते हैं। मैं ऐसे ही नहीं कह रहा हूं, डॉक्टर के नाते कह रहा हूं, और आप इसको देख सकते हैं। रात में जो जगते हैं, जगने से अपने आप थकान होती है, और ये साइंटिफिकली स्टडी की गई है। यदि आप 24 घंटे जग के काम करते हैं तो इसका वो प्रभाव पड़ता है जो आप शराब पीने के बाद आपके शरीर के ऊपर असर पड़ता है। और इसीलिए जो दुर्घटनाएं सड़क की होती हैं, उसका कारण रात की दुर्घटनाएं जानलेवा होती हैं। वो इसलिए होती हैं कि आप थके होते हैं, और थकने पे दिमाग भी, शरीर ही नहीं थकता है, दिमाग भी थक जाता है, और एक्सीडेंट हैपेंस इन द फ्रैक्शन ऑफ सेकेंड्स। इसी के आगे मैं आपको कहूंगा, योगा, एक्सरसाइज, जैसा कि मैंने बताया, स्लीप है, एंड स्पोर्ट्स दे आर द नो कॉस्ट हेल्थ बूस्टर। हर किसी को स्पोर्ट्स का नशा होना चाहिए, क्योंकि मैं तो ये मानता हूं हर आदमी, यदि कोई नशा नहीं करता तो मैं तो उसे आदमी ही नहीं मानता हूं। खतरा वाली पोयम हो तो बता देना, निकाल देना। वो इसलिए हर अच्छा नशा करो जिससे आपका भला हो, आपके परिवार का भला हो, समाज का भला हो। ऐसा नशा ना करो जिससे सिर्फ आपका भला हो। तो ये भी बहुत अच्छी चीज है कि आप कोई भी, जब आपको स्पोर्ट्स का नशा हो जाएगा, मैं बहुत लोगों से पूछता रहता हूं, और आपका भी अनुभव होगा, आप जान लीजिए, बहुत से लोग जो स्पोर्ट्स वाले होते हैं वो शराब का नशा करते ही नहीं है। वो सिर्फ इसलिए नहीं करते हैं क्योंकि उनको वही एक नशा इतना ज्यादा हो जाता है तो कि वो नहीं हो। दूसरी चीज में इसके आगे और बताऊंगा कि आजकल नशे के लिए जो ड्रग्स का है, that is very dangerous, not only for you, for your family as well as for your society. मैं साहब ऐसे ऐसे लोगों को जानता हूं, आपको बताऊं, पता नहीं यहाँ पे उचित होगा कि नहीं, लोग होते बोतल पी लेते हैं, माँ बाप हमारे सामने रोते हैं, और वो कहता, अरे डॉक्टर साहब, अब सर हम तो अब क्लीन है, आज हमने कुछ नहीं किया है। 2 हफ्ते को वो समझते हैं कि उनकी छूट गई, फिर जब मिलते हैं फिर पीने। कहाँ गए थे? वो डी एडिक्शन सेंटर में गए हुए थे। तो मैं ये कहूंगा आप सब लोगों से, नशा बहुत अच्छी है, नशा करना है तो अच्छा करो, ये ड्रग का नशा बहुत अच्छा नहीं। तो पूरे देश में हमारे एक डीजीपी साहब ने एक बार कहा हुआ था, एक मैं प्रोग्राम में था, 16% ऑफ द टीनेजर्स आर ड्रग एडिक्ट। वेरी अलार्मिंग नंबर है सर, विश्वास नहीं किया जाता है, लेकिन दिस इज वेरी अलार्मिंग नंबर है। तो हम सब लोगों से कहेंगे इस बात को आपको ध्यान देना चाहिए। और हम आप सब लोगों से ये कहूंगा कि देखिए, पूरा इंडिया स्टिल इट इज इन द ट्रांजिशनल फेज, it is in the transitional phase. You are the asset for the nation, you are the future of the nation, you should contribute for the nation building. Always think about that. Whatever if you are doing, is it really helping to the nation or not? It is not only for individual help or the family. अरे यार, अपनी फैमिली का हर बाप अपने बेटे की मदद कर रहा है, हर पति अपनी पत्नी की मदद कर रहा है, हर पत्नी अपने पति के लिए कंसर्न है। लेकिन क्या वही होना चाहिए, या हमें सच्चे मानने में वसुधैव कुटुंबकम को प्रैक्टिस करना चाहिए? और ये सब आदतें हैं, इसमें कहीं कोई, जिस दिन से आपने आदत बना ली कि हमें किसी की आपकी मदद करनी है, तो आपकी आदत में पड़ जाएगा और आप मदद करते रहेंगे। जब आपके पास आ जाएगा, क्योंकि देना एक ये है ना, एक कला है, हर आदमी दे नहीं पाता है, देता वही है जो जिसकी आदत में होता है। जब तक आपकी आदत नहीं पड़ी, आप कहते नहीं बहुत धनी आदमी लेकिन है बहुत कंजूस, अरे उसने कभी किसी को दिया ही नहीं तो उसकी आदत कैसे पड़े? और कोई भी काम बिना आदत के नहीं होता, हर काम आदत की हमारी पड़ती है, तभी हम इसको करते हैं। इसलिए इन दिस ट्रांसफॉर्मेशन डॉक्टर मस्ट प्ले ए सेंट्रल रोल, नॉट ओनली एज ए क्लिनिशियन बट एज ए लीडर। Traditionally, the identity of doctor has been that of a healer, someone who alleviates the suffering and cure disease. No, ऐसा नहीं है। While this remains our fundamental duty, हम तो डॉक्टर के नाते कहते हैं डॉक्टरी तो हमें करनी है, लेकिन इसके अलावा भी हम कुछ कर सकते हैं, that we must do it. So डॉक्टर अकेला डॉक्टर नहीं है, he is a counselor as well, he is the educator, he is the social reformer as well. It is not just like and he is the policy maker as well. जब आप बताते हैं कि हमारे यहाँ ये घटना घटी है, तभी तो लोग कंट्रीब्यूट करते हैं, and we are concerned for the communities also. और हमने एक कॉन्सेप्ट दिया हुआ है कि किस लोगों के लिए. आई हैव given an approach, this is called the 7D approach, and beyond the profession, whatever it's beyond the profession, and this I have given a concept of the 7D approach. Whatever you do, you must document that one, you display that, you demonstrate, and you disseminate that thing. Then people come to know and dialogue with the stakeholders. They will take the decision and then deliver the service, whatever you are doing. And once you deliver, it is a cycle, just again documented. And this is not only for the doctors. I am telling you as a doctor कि हम कोई मरीज को करते हैं, हम उसको दिखाते हैं, लोगों को बताते हैं कि हाँ देखिए हमने वो इलाज कर दिया, मैंने एक 16.5 किलो का बोन ट्यूमर निकाला है, तो इसको हमें डिस्प्ले नहीं करना चाहिए. लोग इसको पब्लिसिटी मानते. अरे भाई, लोगों को पता कैसे चलेगा कि हमने ये कर लिया? यदि उन्हें ये पता चल गया कि मैं 2 किलोमीटर की रेस में फर्स्ट आया था और जब 1 ही किलोमीटर की रेस लगानी तो मैं फर्स्ट आऊंगा कि नहीं आऊंगा? Because this is the confidence which gives to the other party as well. So this is the, कहते ना, seeing is believing. जो दिखता है वो बिकता है. इसलिए what you say, you must approach, and this is not only for the one profession, this is applicable to the all profession. अब हम आप सब लोगों से कहेंगे, हम लोग डॉक्टर तो करते ही हैं, डॉक्टरी करना तो बिल्कुल ठीक बात है, इलाज करना ठीक है, बट उससे भी ज्यादा है प्रिवेंशन इज बेटर देन क्योर, बिकॉज it is not only better but it is cheaper as well. So always think about, जैसे हम रोड सेफ्टी की बात करें तो मैं तो कहूंगा यदि आप सब लोग रोड सेफ्टी के यातायात के जो नियम है उन्हीं को पालन करें. और बहुत सारे बड़े नियम थोड़ी है भाई, लेफ्ट साइड से ही तो चलना है, आमने सामने नहीं चलना, हेलमेट को लगाना है, सीट बेल्ट को लगाना है. यदि हम इतने कपड़े पहन सकते तो एक सीट पे हेलमेट भी लगा सकते. जब हम जाड़े में अपनी कैप पहनते हैं, मंकी कैप पहनते हैं ठंड के लिए, तो कभी बचने के लिए हमें हेलमेट भी पहनना है. और हेलमेट हमेशा स्ट्रैप लगी होनी चाहिए. यदि स्ट्रैप नहीं लगी है तो आप सोच लिए आपने पजामा पहन लिया और नाड़ा नहीं बांधा, कब तक हाथ से पकड़े रहोगे उसको आप? और जहां आपके हाथ फ्री हुए तो नाड़ा निकल जाएगा, तो जुलूस निकल जाता है. सीट बेल्ट के लिए कहीं से अलग से पैसे नहीं देने पड़ते हैं, हेलमेट के लिए तो देने पड़ते हैं. मैं तो कहूंगा हेलमेट भी उसी में जैसे पैसे लगा, तो आप 2 व्हीलर खरीदते हैं उसमें कंपनी वालों को और सेल्स वालों को इनको हेलमेट देना, एक नहीं 2 देना चाहिए, एक ड्राइवर के लिए एक राइडर के लिए. उसी में दे दें यार, जोड़ दें, ले लेगा. जो आदमी 1 लाख रुपए खर्च कर लेगा वो 1 लाख रुपए 1000 भी खर्च कर लेगा, लेकिन बाद में उससे कहो 1000 क्या, वो तो 100 रुपए भी खर्च करना उसके लिए मुश्किल होता है. और आप सीट बेल्ट का तो अलग से पैसा नहीं लगता है, तो हमेशा आप सीट बेल्ट लगाइए, हमेशा सीट बेल्ट लगाइए और शराब पीकर गाड़ी नहीं चलाइए, क्योंकि रात की घटनाएं जानलेवा होती हैं. और इसलिए भी आजकल रोज हो रहा, मैंने एक कॉन्सेप्ट दिया AAA कॉकटेल. आप समझते होंगे कॉकटेल का मतलब, जब आप मानते हैं उम्र अपने आप में एक नशा है या नहीं है? नशा है. देखिए इसने आज ही कह रहे हैं, दूसरे लोग शर्मा रहे हैं कि हम ऐसा क्यों कहें, ये सच में उम्र एक नशा है. इसके बाद आप ये सोचिए, आपने शराब पी लिए तो वो दूसरा नशा आ गया, और आपकी अमीरी है तो उसका अपना नशा है. तो ये कॉकटेल है, और सड़क दुर्घटनाओं में ये कॉकटेल आग में घी का काम कर रहा है. जो पुणे में घटना घटी वो एक चीज है. आप सोचिए, अभी मैं गुवाहाटी में था, पिछले हफ्ते घटी है. पुणे में तो 90 मिनट में 48,000 की शराब पी थी उन्होंने. अभी असम में, क्योंकि हाँ पुणे महाराष्ट्र जितना डेवलप नहीं है, तो असम में वहां 19,000 की शराब पी गई थी. 6 लोग थे, वो 3 लड़कियों की डेथ हुई. पिछले हफ्ते की घटना है. तो इस बात को आपको ध्यान रखना चाहिए, और इसके लिए हम ये समझते हैं कि आपको नहीं करना चाहिए. मैं फिर आप लोगों से कहूंगा कि हम सब लोगों को अपने देश के लिए नेशन बिल्डिंग में अपना योगदान देना चाहिए. आप यंग डॉक्टर्स हैं, डॉक्टरों का बहुत रोल है, क्योंकि आप ऐसा कोई दूसरा प्रोफेशन नहीं है कि जिसमें हम अपनी इच्छा से पैसे मांगते हो और फिर आपके वो पैर भी छूता है. ऐसा कोई दूसरा प्रोफेशन नहीं है. लोग बताते हैं पुजारियों का ऐसा प्रोफेशन है, लेकिन मैं मानता हूं उस देश में कितने लोग पुजारियों, कितने लोग पूजा कर रहे हो, कितने लोग पूजा करने जा रहे हैं. तो तो इस बात को मैं समझता हूं, और डॉक्टरों का एक ऐसा प्रोफेशन है कि जिसमें हम सब लोगों को, और मैं कहूंगा, एक ही बात कहूंगा, कंक्लूड करूंगा कि आई वुड लाइक टू लीव यू विद अ सिंपल एट प्रोफाउंड थॉट, मूवमेंट इज लाइफ। गति ही जीवन है, ठहराव है मृत्यु। तो आप लोग ऐसे डॉक्टर हैं कि अपने को भी गति दें, समाज को भी दें, परिवार को दें, क्योंकि इसी गति से हम सब लोगों में बदलाव आएगा। Doctor must not treat the illness, as I mentioned. They are meant for to prevent the suffering of the others, promote the wellness, lead the transformation of the society. ऐसा जैसा कि हमारे माननीय प्रधानमंत्री का एक सपना है कि 2047 तक हमारा देश है वो विकसित भारत की श्रेणी में आना चाहिए। और वो कब आएगा? जब आप लोगों का योगदान होगा। एक कविता के माध्यम से, इस मंच के माध्यम से हम सब लोगों को, आप लोगों को एक कविता के माध्यम से अपील करता हूं कि आप सब लोग इसमें अपना अपना योगदान दें। कविता का शीर्षक है विकसित भारत ध्येय हमारा। धीर धरो प्रिय वर थोड़ा सा, रात्र जल्द ढलने वाली है, भोर शीघ्र होने वाली है। उठो देश का मान बढ़ाएं, मातृभूमि का कर्ज चुकाएं, विकसित भारत ध्येय बनाएं। एक साथ हम हाथ मिलाएं, साथ साथ हम कदम बढ़ाएं, भोग विलास छोड़कर हम सब कर्म करें मिलजुल कर हम सब। गूंजे मंत्र यही घर घर में, उठे तिरंगा बने निडर हम, होए अग्रसर इस पथ पर हम, यह बल हमें दिखाना होगा। बड़े देश अब स्वर्णिम युग में यह कर्तव्य निभाना होगा। रात्रि जल्द ढलने वाली है, भोर शीघ्र होने वाली है, अंधा युग जाने वाला है, स्वर्णिम युग आने वाला है। बड़े चलो सब भारतवासी, बड़े चलो सब भारतवंशी, बड़े चलो सब भारतवासी, बड़े चलो सब भारतवंशी। मैं 1 मिनट और लूंगा, आपको एक कविता के माध्यम से आपको धन्यवाद दूंगा कि आपने मुझे सुना, और मैं आपको कविता के माध्यम से शुभकामनाएं भी देना चाहता हूं। इसका पार्ट, जैसे जैसे सपने बढ़ते हैं वैसे वैसे जीवन बढ़ता है, जैसे जैसे सपने बढ़ते हैं वैसे वैसे जीवन बढ़ता है। मैं तो कहूंगा सपनों को बुनो, पालो, पोसो, बढ़ाओ अपनी पूरी लगन और मेहनत से, क्योंकि सपने ही तो भविष्य हमारा आपका। हाँ, अपने सपनों को पूरा करने के लिए दूसरों का सहयोग लो, और दूसरों के सपनों को पूरा करने के लिए अपना सहयोग दो, क्योंकि जीवन का आधार ही है सहयोग, क्योंकि जीवन का आधार ही है सहयोग। सहयोग के बिना हम सबकी उत्पत्ति नहीं हुई होती, सहयोग के बिना हम सबकी उत्पत्ति नहीं हुई होती, ना ही होता इतना विकास एवं विस्तार। आज यहाँ जो पूरा हो रहा सपना ही तो था, और क्या। हमारे सपनों को संवारने के लिए आपको धन्यवाद, और आपके सपनों को संवारने के लिए हमारी शुभकामनाएं। नमस्कार, जय हिंद।
Thank you, sir. Thank you so much, sir. With these words, we'll start with the Sarvarogya program. Thank you so much for your insightful words and encouraging our students. Thank you, sir. Thank you. Thank you. Namaste.
नमस्कार।
Yes, Shivam, I think you can start with the presentation now.
Sure, ma'am.
Yes, Shivam.
Just starting. Is my screen visible? So we previously discussed about the qualitative research. As we talked about, it is capturing the emotions. That the word qualitative is literally in the quality. So we try to capture the quality in the qualitative research. As we give a simpler explanation for you. Imagine you want to understand why a student in a village are dropping out of school. You don't just count the number of dropout. you literally just go with your parents or the kids or the teachers that why they are dropping out. That is called the qualitative research. You are collecting the experiences, not the only stats or the data. So we do the qualitative research when we use the qualitative research when we want to study the how a community feels about a new dam being built nearby, or want to capture the community experiences, like exploring how slum dwellers manage water during a shortage. This is just a common, simpler example. Uh, we can go further with the example like Netflix uses qualitative research before they release a show. They are in focus group, actual people sitting in a room watching pilots and reacting. The data wasn't a pie chart; it was the conversation. I didn't connect with the character, or I love the tension. That is the real qualitative research. Now we move to the quantitative research. As quantitative research is a method of collecting and analyzing numerical data to identify patterns, test hypotheses, make prediction. It is just opposite to the qualitative research. As simply, we can take the data and statistics in this type of research. Advantages of this type of research is that you can make when you want to measure the size of the problem, you can use this type of research. When you want to compare group of regions, the main advantage of quantitative research is that you can generalize the overall data, but there is a drawback that it oversimplify the complex phenomena. As in qualitative research, you capture the aspect of why it is happening, but in the quantitative research, you only capture what and how much. So there is some written. Now we move to the third part, which is the mixed method. Oh, sorry. Now we move to the third part, which is the mixed method. So mixed method research is a research approach that deliberately combines both qualitative and quantitative methods, as you can identify it by the name, which is mixed. So it just comes with the why and what. It captures both the aspects. For the simpler explanation, let's use the health example. You want to study malnutrition among children in a slum. Using quantitative method, you measure weight and height of 200 children, or suppose any X number of children, and calculate their nutritional status. But using qualitative methods, you then interview mothers to understand their feeding practices, social culture, food availability, and cultural beliefs. Together, you get both the scale of the problem and the reason behind it. That is the mixed method. And we use the mixed method when we have to study the effect of the health program, or we have to cover the complex problems. The approach is beneficial when a research question encompasses complex phenomena requiring detailed insight and a statistical analysis to answer effectively and truly. There is a word which is called triangulation. It is a very beautiful thing. Here is the term worth knowing. It means using multiple methods to verify and strengthen your findings. If your survey says 60% of mother have poor hand washing practices, and your in-depth interview also show mother are unsure about whether to wash hand, then you can have triangulation, two different methods pointing at the same point. This makes your finding much stronger. As you can simply say that if qualitative is the story and quantitative is the data, mixed method is the documentary. It gives you the both the footage and the statistics of the research. Now we move to next, which is the data collection method. Now that we know that the three types of research, let's talk about the tool we actually use to collect the data. So data collection methods are only the tool which you use. So first one is the qualitative technique, which is definitely used in the qualitative qualitative methodologies. In qualitative techniques, there are individual in-depth interviews in which one researcher, and there is a depth of discussion of open conversation. For example, asking a community health worker about challenges she face daily, or we can there is another type of qualitative techniques, that is focused group discussion, which brings 6 to 10 people together to discuss a topic. The conversation between participants generate insights should never get one-on-one. Example is that asking a group of mother about infant feeding practices. This will give you the whole scenario of the real condition. The another type of technique in qualitative is key informant interviews, in which interviews with expert officials or community leaders who have a special knowledge. For example, you can say that interviewing an ASA worker, a panchayat head, or a district health officer, which will give you a brief information about the overall situation. And you can also use the observational technique in the qualitative technique, as the researcher watches the without interfering. For example, you can say that observing how a government hospital handles the patient flow, it will not take so much effort, but it is just take you the observational skill for that qualitative technique to happen. And now we move to the quantitative technique, in which the following tools are the structure surveys or the questionnaire. It is the fixed question and the fixed answers option used to collect data from many people quickly. For example, various surveys like NFHS data or any consensus are like those. And the another tool in quantitative technique is experiment or randomized control trials, in which you test a change in one group and compare with a control group. For example, testing whether a new nutrition supplement reduces anemia or not. You test in on the one group in which you have given the supplements, and you compare it with the another group which didn't give you the supplement. So it is randomized control trials, which is also known as RCTs. And the third technique or tools in quantitative technique is secondary data analysis, which is using already existing data like census, NFHS, HMIS, or other government report or any other articles. As you can say, using NFHS data to compare state level malnutrition rate. It is pre-existing data here. Now we move to the mixed technique. As you know by the name, mixed techniques combine both qualitative and quantitative method to collect comprehensive data. The magic word here is triangulation, which we previously discussed. So now we move to the next slide, which is about the informed consent is essential, which comes under the ethics of the research. So it is we start with the definition. As as we start with the definition, just give me a minute. Informed consent is a process by which a researcher fully explains to a participant what research is about, what it involves, and what their rights are, and then get the participant voluntary agreement. And what is involved, and the key word is informed. It's not just about asking, "Can I interview? Can I interview you?" It means the person genuinely understand what they are agreeing to and is agreeing freely, not because they feel forced. You don't have to give any pressure or confuse the participant. Just think like a way that when you go for a surgery, the doctor doesn't start operating. They explain the procedure, the risk, what alternative exists, and ask you to sign a consent form. Researchers work on the same way. You must respect the participants' right to know what they are getting into and their right to say no. As you can say, participant understanding is very important. The person must actually understand what you told them, not just nod. Use simple language, their language if we need it. And we also look at the purpose of the research. Be honest and transparent about why are you doing this study, who will see the data, where will it be published or used, and there must be an option given to them that they have a right to withdraw. The participant must know they can stop at any time for any reason without any penalty or bad consequences. And there is also ethics related thing is that plagiarism. As for plagiarism, is the act of using someone else's ideas, word, data, or work without giving them the credit, presenting it as if they were your own. It is a form of intellectual theft. As you can simply say that copy pasting without citation is plagiarism. Paraphrasing without a citation is also a plagiarism. So be very mindful about using someone else's work and making it proper citation. I already told you the definition. We also talk about the prevention in future. Now let's look at the table of content from our previous researchers. As ma'am previously showed you about the obesity, this formalization of pharmaceuticalization of the obesity. Now we move to how the structure of the report is built. As for the starting, we start with the executive summary, but it is not built in the start. It is a short, powerful summary of everything your reports contain. The problem, what you found, and what you recommend. It should be able to stand alone. Someone who reads only the executive summary should know the entire story. It is always written in last, even though it appears first. You cannot summarize the something you haven't written yet. You should include the problem you studied, why it matters, your key findings, and your top 2-3 recommendation and suggestion. It must be not more than 300 or 400 words to not create excess jargon. Now we move to the introduction part. What should we cover? We discussed it later. Now we move to the chapters, as in the rise of foundation. the most of the reports are divided into different chapters. So for the chapter, this is the first major content chapter. The title of chapter 1 depends on your topic. Typically, it's cover the background and the context. The what is the problem section for the rise obesity report is given in the table of content. As you can see, the it was titled the obesity challenge. It is explained what obesity is, how widespread it is, and why it matters globally and in India. For the malnutrition, it is also for malnutrition or any for related to another work of anemia. I remember you can name it the what is the anemia or what is the prevalence of anemia. And now we move to the chapter 2, the second major content chapter. This is usually where you present your data, your findings, what you found in the field, what the numbers show, what the interviews reveal. In academic terms, this is your result and analysis section. For the RISE report, chapter 2 was the rise of anti-obesity pharmacotherapy, moving from the problem to the current situation landscape. For your study, chapter 2 will present the survey data, as you can look at the prevalence of the anemia and how it is going in the or other social aspect of the anemia. And then now we go to the suggestion and recommendation, which we also dedicated a full slide. Let's discuss the conclusion and reference here. For the conclusion, it is a brief wrap up, usually 2 to 300 words. It does not introduce new information. It restates the core problem, summarizes your key findings, and end with a forward-looking statement about what your research contributes to the field. And when it's come to the references, every source you use listed in order. The Rice Foundation uses the Vancouver style. We have a dedicated slide on this, so we move to that. Currently, we look at the structure of the policy brief. The executive summary will be the same. Introduction is also the same. The major part of the policy brief is the policy and legal framework. This section is unique to policy brief, as is one of the most important. Here in this section you answer the what laws, a scheme or policy already exists that are supposed to address this problem. What does the constitution say? What national program are in place? And what is the international frameworks working in this? For example, you can say that you are writing a policy brief on child malnutrition. You could cite Poshans, Abhiyan, ICDS, midday meals, or other scheme working on this. This session shows that the legal and policy foundation exists, but the real question is whether it is being implemented or not, whether the work has been done or still in the progress. Now, the second major chapter is the problem statement, which is the implementation gap. This is the diagnosis section. What is actually going wrong? Where is the system falling? Why are the existing policy not working? This is a different from stating the problem. It specifically examines the gap between the policy says happen and what is actually happening on the ground. For example, ICDS is supposed to provide supplementary nutrition, but in different districts, coverage is only very less. Suppose the coverage is only 20% due to staff shortage or any other issues. That is an implementation gap. Now, the next major chapter is evidence and ground realities. This is your data section. The hard evidence. What does your research, your survey, your interview show? The data literally what you research. What do their studies say? What does national data say? This is where your all fieldwork data lives. Your survey of children, your surveys of doctor interviews, your surveys of women's in case. The findings about the stunting rate or any practices, this all goes here. Evidence plus ground realities means you are combining academic evidence with the lived reality from the field. And for the next big chapter, it is policy recommendation implementation roadmap. As we going to discuss the policy recommendation, this is the most action-oriented section of the entire document. Based on everything you have shown, the framework, the gaps, the evidence, what should be done? You should be specific here, not improve nutrition, but deploy community nutrition counselor in every Anganwadi. It is just a brief, but for the implementation roadmap, you must explain how your recommendation can be carried out. Who is responsible for carrying out this? What is the timeline? You must give the timeline for your project to work. What resources are needed? What metric will measure success? And now move to the conclusion and reference. It is discussed previously. Now we move to the introduction. How introduction must be written. In the simple purpose, you can say that the introduction is the first real piece of writing your reader encounters. It Its the job is to answer two questions the reader has before they even starting reading. Why should I care about this and what am I about to read? Think of it as the first 2 minutes of a really good show. It has to hook you, give you enough context to understand what's going on, and make you want to keep watching. If your introduction is boring, you have already lost your reader. The reader will not follow up your report or policy brief. So you must write the introduction very with being very mindful. What a good introduction must cover as the key things. Uh, I think the best thing they said cover is what is the topic. You must state clearly and simply that what is the problem, issues or the phenomena which are you studying. And the next main point is the why this research is happening. You can state the background and the problem in this section. And the third important thing is the relevancy. It shows that why this matters today, why your research is going to matter in this fast changing world. And the next big point is the utility gap or the research gap. As in this section, this is crucial. What does this existing research not tell us? What question has not been answered? What population has not been studied? This is your justification for why your study needs to be exist. For example, you can say that there are various national level data on the malnutrition or anemia or any other thing, but there is limited evidence of nutritional status or the anemia status or the prevalence. So you should must think about that. What are the real gap in those researches? And then we move to the what this research aims to fill. Based on the gap, you identify what your study aims to find out. You should clearly state your objectives and use direct language. This study aims to assess the prevalence of anemia or anything related to you. And then you must also write the scope of the research, that what's in and what's out to be the in this research. The common mistake which most of the students make that they write an introduction that are just a copy paste of the background information from the Wikipedia or the web. A good introduction is not a summary of everything ever written about your topic. It is a funnel, starting broad and narrowing down to your specific study. And now we move to the policy recommendation. As policy recommendations are actionable evidence-based suggestions directed at governments, institutions, NGOs, or communities. This tells them that especially what they should do to solve or improve the problem your research identified. They are the bridge between the knowledge and action. This slide capture it perfectly. Researchers don't just stop at here what we found. They go beyond, and this based on their finding, here is what actually must be done in the real world. You must keep your clinical and public health steps here. As I think, Paul, we also want to address the important thing. Why are the policy recommendations most important? As they turn knowledge into action, and they help decision makers to not everyone can interpret data. So you can translate it into the clear steps. They make the research useful and impactful. As you done a great research, but what are their impact? So you must recommend that this research will going to create a huge impact in the future and how it's going to create an impact. Then they guide the better policies. Good recommendation leads to better laws, programs, a scheme, and strategies. I think the things that make the good recommendation is that a strong recommendation is like municipal corporation in class B cities or the tier 2 cities should ensure functional toilets to household ratio of 1:5 informal settlement without monthly sanitation inspection conducted by ward level. But you should provide a clear that how this recommendation should work. You should use a smart technique here. As I can say, a smart SMART. From SV, you can say that you must be a specific. From M, it must be a measurable goal. And from A, it is actionable. And from R, it is responsible. And from T, it is time bounded. Your policy recommendation must follow the SMART theme. And for next, we go to the referencing. As in the RISE, we use the Vancouver style of referencing. But why do we need reference? Before we get into how to get the reference, let's remember the why. References exist to give credit to the people who work you use. They also allow you to reader to go back and verify your sources. And they protect you from plagiarism. Every claim you make that is not your own original idea must be cited. And now we move to the how Vancouver style works. Every time you use someone else's idea or data in your text, you put a number in the bracket or as a superscript. There is an example in the next slide, but let's focus on how it's the Vancouver style referencing works. That number points to a full reference at the end of your document. Every time you refer to the same source again, you use the same number. At the end of the document, you list all the references in order they appeared in your text. As for as you can see here, just give me a minute. As you can see here, there is a number written here. Oh, sorry. Just look at there is a number written here in the superscript, and the same resources has been used here in the references slide down there. So this is the important for two reasons. First, it shows you the Vancouver referencing in practice, not as a theory, but something real, published and professional, as it is previously used by our organization. As you can see the in the references that author names follow the last name plus initial formats. Journal names are abbreviated. Years and volumes are issue number, page number are included here. There are no quotation marks around the titles. So you must reference according to this Vancouver style of referencing. Thank you for your implementation. Thanks. That's over from my side.
Now we shall open the floor for the interns to introduce themselves. Yes, one by one. You all can come up, switch on your camera and introduce yourself and the topic you are working on. Yes. Yes, anyone? Rohan, can we start with you?
Just one second, ma'am. I'm reconnecting the call. Network is there. Just one second.
Okay, no problem. Lakshya,
Hello everyone, I am Dr. Lakshay Sharma. I am currently pursuing MD in preventive and social medicine, that is community medicine. Uh, the project given to me is possession narrative and India's treatment gap, a doctor-led public health response.
नाम लो. नाम ले.
yes, Rohan.
Good evening, everyone. My name is Rohan. I'm currently a final year medical student at ESHC Medical College and Hospital, Faridabad. The topic that is given to me is postpartum depression in India, the prevalence, risk factors, screening gaps, and public health framework for its action. And I'm really excited to be working with the team, and it was a very informative session. Thank you for this introduction session. Thank you, ma'am.
Great. Pranjal,
Good evening, everyone. My name is Pranjal. I am an intern from Dr. VMGMC Solapur. I am currently residing in Pune. The topic assigned to me is clinical and public health strategies to address India's persistent anemia crisis. Through this topic, I look forward to understand the gaps that is causing anemia and how to address the same. Thank you.
great. Kirtana,
Hello, am I audible?
yes, you are. You can, yes.
Okay. So, good morning. Sorry, good evening. I'm Kirtana, and I'm currently an intern doctor at Madras Medical College, Chennai. And the topic given to me is strengthening last mile access to essential medicines and diagnostics. We have a major healthcare gap in terms of the amount of medicines available, and also in procuring the necessary investigations to make timely diagnosis. So through this policy brief, I hope to explore the lacunae in public health and diagnostics, and as well as come up with solutions which are implementable and we can fix these problems.
Great. Looking forward to it.
Thank you.
Vidalson? Vid-
Good afternoon, everyone. My name is Udal Sonwojne. I am a graduate, a physician. I am also a postgraduate in public health data science, and I am currently enrolled in international public health. The topic that was assigned to me is strengthening early warning and response system for epidemic-prone disease and resource limited setting. And this subject will help to build effective early warning and response system through stronger surveillance protocol. And I hope it would be a source such good bonds with you by sharing knowledge and contribute to the project. Thank you.
Thank you, Vidalson. Looking forward to it. Pratibha? Pujitha?
Hello everyone, I am Pujita Aita, a third year medical student at Government Medical College Sangareddy. And the topic assignment for me is screening for early cardiometabolic risk detection in young adults. And I'm so excited to work with you all. And thank you.
Thank you. Anyone is left? If anyone is left, please switch on your camera and introduce yourself.
मैं भी अपना परिचय दे दूं दीदी, स्नेहा
जी
दीदी।
जी
मैं मैं पटना बिहार से जुड़ा हुआ हूँ और इस कार्यक्रम की जानकारी सर के माध्यम से मिली थी और मुझे बहुत अच्छा लगा जुड़कर। और सर ने जो मार्गदर्शन किया, जो अपनी बातों को उन्होंने रखा, एकदम शुद्ध हिंदी भाषा में बोलकर उन्होंने जिस तरीके से मार्गदर्शन किया, सही मायने में उनका तो सुनना अपने आप में ज्ञानवर्धक है हम सभी के लिए, क्योंकि जिस मुकाम पे वो हैं और जिस जगह पे हैं उनके साथ तो जुड़ना हमेशा ही हमारे लिए ज्ञानवर्धक रहेगा। सोचिए कि मैं बिहार से बैठा हूँ, अगर ये प्लेटफॉर्म नहीं होता तो आप लोग से कैसे मुलाकातें होती और कैसे बातें होती। तो इस तरह का कार्यक्रम होता है तो मुझे नहीं लगता है, मैं पत्रकारिता का छात्र रहा हूँ, मेरे लिए ये विषय अगर देखा जाएगा तो कहेंगे तो कि ये मेरा विषय तो नहीं है, मगर ऐसा नहीं है, सारा विषय हमारे जीवन शैली से जुड़ा हुआ ही होता है। तो मुझे लगता है कि ऐसे कार्यक्रमों में जुड़ने के बाद कुछ जानकारी होने से ये कुछ जानकारी बहुत कुछ करके दिखाती है। जैसे में हमें लिखने का भी मौका मिलता है, अगर मेडिकल की फील्ड में अगर मुझे लिखने का मौका मिलेगा तो जब तक सुनेंगे नहीं, अच्छा श्रोता नहीं बनेंगे तो अच्छा वक्ता भी नहीं हो सकते हैं। तो इसलिए ऐसे कार्यक्रमों को नितांत निरंतर आप करवाएं। जैसा कि उन्होंने प्रेजेंटेशन में बहुत सारी चीजें जो बता रहे थे, बहुत ही अच्छा लग रहा था देखकर। वो कुछ 2-3 चीज मैंने भी उतारा है, मैंने लिखा भी है, बहुत अच्छा लगा। जानकारी के लिए जानकारी होनी चाहिए लोगों को, और हेल्थ से रिलेटेड तो बिल्कुल होनी चाहिए। इसलिए मुझे बहुत अच्छा लगा। मैं पटना बिहार से हूँ और मौसम भी थोड़ा इधर साथ नहीं दे रहा है, बारिश का मौसम है इधर। तो बहुत अच्छा लगा आप लोग के साथ जुड़कर। अब आगे की कार्यक्रम करवाएं तो अगर मुझे जानकारी मिलेगी तो मैं अवश्य जुड़ना चाहूंगा। धन्यवाद।
बिल्कुल, आपको सेव बुलाया जाएगा और हम आशा करते हैं कि इस प्रोजेक्ट से, सर्वारोग्य नाम है, इससे हम कुछ अच्छे रिपोर्ट्स और पॉलिसी ब्रीफ्स आपके सामने लेकर आएंगे। थैंक यू सोनू जी जुड़ने के लिए। थैंक यू and thank you all for being a part of this orientation session. It was great talking to you. It was great listening to Sir. Sir is a very experienced person. It's always good to hear him. He's very inspiring, and he has a tremendous achievement record. So, looking forward to meet you all. Also, there shall be a mentorship interaction scheduled tomorrow. You'll all get the mail by end of the day today. So, looking forward to have a personal interaction with all of you. Thank you all for joining. Thank you all.
I got a question, please.
Thank you. We'll end the session now.
I got a question. Hello.